Here we go. Alrighty, so do you give me permission to talk about your health history in detail?
Yes, of
Awesome,
course.
thank you. Alrighty, so we'll just review your filled out health history here. So the first yes is your abnormal high or low blood pressure. You want to tell me a little bit about that? Is it low, high?
Just right.
Just right? I was gonna say, it looks like you were
We had a little bit
taking,
of high blood pressure, which
Okay.
is typical of getting older. Your blood vessels kind of constrict,
yeah,
and so then it creates more pressure. But-
okay.
So we're on a basic medicine, metroprenol for that.
Okay, how long have you been taking that for?
I don't know, a long time,
A couple, yeah.
15 years. I
Oh,
guess.
okay, yeah, so even more than I was thinking. Well, great, and that's been going okay for you, able to
Yes.
manage it a little bit better?
Don't even know it. Yeah,
Great, I
it's
would say
fine.
today your blood pressure was 123/71, so it looks like it's able to keep it more into that elevated region, so that's great,
Yes,
not
definitely.
overly elevated or anything.
Along with exercise.
Good, yeah, great, I was gonna say, good job, keep that up then, it looks like it's doing good for you. And then the next yes looks like heart problems. You wanna tell me a little bit about that? It looks like the detail was atrial fibrillation.
I was diagnosed with it, but I
Mm-hmm.
would not know I have it. And but people, heart doctors, can listen and they can detect it.
Mm-hmm.
So I'm on a medicine for that called can't think of it.
Is it the Eliquis?
Yes, Eliquis.
Eliquis, okay.
So that's sort of an anticoagulant. So that you don't get blood clots, which is what they're concerned about with atrial fibrillation, where your heart valves are not quite in perfect sync and there's a chance for a blood clot, which then dangerously could go up to the brain
Right.
and you could have a stroke.
Yep. Say, look at that, you know so much about it. Look at you. Okay, and then how long ago were you diagnosed with that? Has that been a while as well, or is that fairly
Probably
recent?
Relatively recent, probably about maybe 3 years.
Within
at
the
the
last
most
3
now.
years? Okay. And you said you don't notice any symptoms, doesn't bother you, it's just
No.
something the doctor noticed and is monitoring for you?
Don't even know I have it.
Good.
No.
That's great.
No problems at all.
Alrighty, and then the next yes right here we have is arthritis, rheumatoid, or gout, and it looks like it was gout. And then it looks like in your big toe 3 to 4 years ago, and you haven't had any issues since then? Any flare-ups, or does it kind of come and go for
I
you?
had one about a year after that, probably been 3 years maybe now,
Okay,
where I got some gout in my wrist.
oh, okay,
And it can happen most of the time in the right big toe
yeah,
joint, but you can get it in your wrist or maybe even your elbow, I don't know.
okay,
But it's extremely painful.
yes,
And so I'm on allopurinol,
okay,
which is prevents gout. So
that's right, okay, I do
haven't
see
had
that
any
here.
difficulties with it at all.
Okay, great. And you take that one time a day, and then, like you
do.
said, it's been able to hold
Right.
that off and stuff for you. Great. I'm so glad to hear that because I hear that it's painful. So if we can keep that pain away for you, that's wonderful. And then your next yes here is a previous cancer. It looks like it was colon cancer about 10 years ago. You want to tell me a little bit about that?
Well,
When
that
you-
was diagnosed by my PCP
Okay.
when I was getting ready to go in for my first hernia operation.
Okay.
And they discovered that there was a problem, and so they wanted me to have additional tests and additional colonoscopy to determine whether I had cancer or not. I did. I had colon cancer, and they showed me a picture of it. It looked like little grapes within your colon.
Wow.
So I had an operation, and they took out actually about a foot of my colon.
Okay,
which
that's
a
what I was
lot.
wondering. Yeah.
So everything has been fine since then, and become cancer-free for the
Good.
last
10 years or so.
Yeah.
Do you know at what stage they caught the cancer at? Was it stage like a pretty early stage
It
then,
was,
or yeah?
and at that early stage, it's not definitely having a chemo situation. Well, it was like you can have chemo or not.
Yeah.
And I decided
Against.
not having the chemo, that I would just trust the Lord.
Yeah, I was gonna
And,
ask that next. So you didn't need any chemo or radiation
No.
because you went in for surgery and they were able to remove everything.
But sometimes at that stage, at the one stage, it's a real questionable thing whether you want it or not.
Yeah.
And the obviously I chose not to. The doctor also feel if you get it again, I'll cut it out again. So,
Well, I'm
if there's
so
any colon left.
yeah, I'm so glad that it's been well for you and that's monitored for you and everything, and you haven't had any, say you're in remission. Hasn't.
No, it's
That's
totally
awesome.
gone.
Good. Well, I'm glad for that. Are you regularly seeing your doctor for other, cancer types like skin cancer? Checked regularly. Everything else.
Well, I go in for skin cancer.
Yeah.
On my head, basically, and I had one little thing removed on a leg.
Okay.
These things show up later years, as you know. Nothing real serious at
Good.
this point.
Good. I'm so glad for that. Okay. On to the next one then. I think we addressed all of those. And then your current medications, I know we mentioned a couple of them. The alpunerol, which was for the gout, Eliquis for the AFib, metoprolol for high blood pressure,
Right.
taking multivitamin, a coenzyme Q10, a vitamin D, magnesium, and then recently the atorvastatin was added for the cholesterol. Does that sound right?
Yes.
Yeah.
That's statin. We would have had
Yes,
that for
yeah.
a long time.
Okay, yeah. Great, I would say those were great there. And then still under the care of a primary physician, priest and hospitalized, and they're full. Okay, well, it looks like everything there is good. Do you have any other questions or concerns for me at all about that?
No,
No?
I think you covered it very thoroughly. You did an excellent job.
Okay, so reflecting on my patient interview video with my patient who was ASA class 2. Overall, I feel like I did okay. Always areas that can be improved. But for my patient, he was ASA class 2. Due to him being in his 80s as well as having hypertension, a mild controlled systemic disease. So he has high blood pressure, taking medications. One thing that I feel like I did okay on was I had a double screen up, so the clinical note as well as the document full of the health history, so I was able to kind of go back and forth with details that actually what I had done originally was I went through the stuff for the day, got it signed off so that I wasn't holding up my instructor. So some of the stuff I feel like I had already kind of talked about, and I maybe missed some of the points in the video, although I've had previous conversations with him before. But one of the things was I feel like I did okay with having a double screen up, and it saved me from having to kind of bounce around a little bit. But I feel like I did kind of bounce around a little bit with addressing his yeses and medications. Because then I kind of was like, oh, you have this, you're taking this. Like, I didn't really maybe mention the medication by name in that moment. I was like, oh yeah, you have high blood pressure, you're taking medication. Okay, moving on. I tried kind of prompting him questions about having him tell me about his symptoms, his experiences, how long, carrying the history from him, and then me kind of prompting questions to fill in the blank. But one thing was he was very knowledgeable about his medication and the way that it affects his body, and the way that it works and the process of everything. So I felt like there wasn't much for me to contribute, because I was like, oh, he already kind of knows a lot of this. So I felt like, okay, well, he knows it, even though I probably could have found like, okay, he hit this and this point, but he didn't really touch base on this. Let me do that. I kind of was like, oh, wow, you are doing so good. Good job. Okay. You already know about it. Like one of the things was we've talked previously about was his possibility of the side effects of his medications was xerostomia. And he does notice it a little bit. So we've talked before about, the increase of cavity or caries risk and everything. And that wasn't something at all that I mentioned this time, going over his medications and re-talking about that. So just something that I could have done a little bit better there. And then overall for like that stuff, I feel like was okay. Going over your rubric, here it is. For the professionalism, I scored myself a 10 because I felt like I was good at maintaining eye contact and acknowledging what he was saying, prompting his questions and never really having a dull moment of, it was a good flow of the conversation. And I feel like I stayed professional and informative for certain things. The individualized care and questioning, I decided to give myself, I think that one was a 5. But then the mastery of the subject matter was a 3 because, like I said, I could have done better of relating the medications, like his blood pressure, one of them that he was using, about how it can affect the rest of his body and side effects, or more things like that. I kind of just left it at what he was saying and then didn't really add too much more. We kind of kept the general, which I maybe could have gotten a little bit more specific in some things. And then reflection, I mean, I give a 5 because it met all the requirements. I think we did a good job of addressing all of his guesses, and then separately addressing his medications, seeing where they kind of overlapped and crossed over. But overall, I feel like it was a good appointment, good information gathering with him and everything. So